Hi, Brady and Donald. Thank you for coming in for your pre-assessment screening appointment. This here is an informed consent form. You will need to sign this in order for me to guide you in this pre-assessment screening. This is here for your own safety and for confidentiality purposes. Feel free to withdraw at any time. On the back of this form is a pre-assessment health screening questionnaire which asks about family history, personal history, symptoms, and stuff like that. So I'm going to need you guys to go and fill that out.
Okay.
Just hand it back to me when you're done. Alright, all done?
Yep.
Okay. The purpose of the screening is to make sure to put you in the right exercise program with the right intensity under medical supervision if needed. If there are any major signs or symptoms that suggest cardiovascular, pulmonary, or metabolic disease, you will be in the high-risk category. What I mean by high-risk category is you will need medical supervision during any form of exercise, and a health examination will need to be done prior to that exercise.
Okay.
Depending on the number of cardiovascular disease risk factors, which I have right here, if you guys want to give a quick look at that. The number of those determines if you are low risk or moderate risk. Having two or more of these factors will, having two or more of these cardiovascular risk factors puts you at moderate risk. If you have less than two, you are at low risk. Do you guys have any questions?
I don't think so.
I think it's okay.
Yep.
Let me go ahead and review your pre-assessment health screening questionnaires. I will look over yours first, Brandy.
Okay.
Alright, it shows here that you have no family history of heart attacks or sudden deaths before the age of 55.
Nope, nothing.
Alright, it shows here that when you work out you have chest pain.
Yes, I work out 5 to 6 times a week for about an hour, and I do get chest pain, so my husband tells me to smoke a cigarette after that.
Well, that's very bad advice, sir. I don't recommend that by any means. I hope I made that clear. Okay, it shows that you have type 2 diabetes.
Yes, I got that at age 35.
Okay. Your cholesterol is 210, is that correct?
Yes, that is.
Okay, well, since you have chest pain and type 2 diabetes, this instantaneously puts you at high risk. We'll go over the rest of your risk factors.
Okay.
Do you know what your fasting plasma glucose level is?
No, I do not.
Okay, that'll be a risk factor.
Okay.
Do you smoke?
I do smoke 2 packs a day, and on a bad day I'll smoke 3, as you can tell by my voice.
Yeah, I definitely can tell by your voice. I always recommend that you quit smoking.
Okay.
What's your height and weight?
My height is 5'6", and my weight is 120.
Okay, I'm going to go ahead and calculate your BMI.
Sounds good.
Okay, your BMI looks good. It's a 19.3. If your BMI were to be 30 or higher than that, that would classify you as obese, and that would be a positive risk factor. But you are okay in that category.
Okay.
Are you below the age of 55?
Yes, I am 54.
Okay. You don't look that old.
No.
Okay, well, like I said, you are a high risk. You have 4 risk factors with the addition of the chest pain type 2 diabetes. That puts you at high risk.
Okay.
You will need a health exam prior to any moderate or vigorous exercises, and medical supervision will be required for maximal and submaximal exercise. Do you have any questions?
No, not right now.
Okay. I'll go ahead and move on to you, Donald. Let me check out your questionnaire.
Sounds good.
All right. You two have no family history of sudden death or heart attacks?
Yeah, that's right. None of that.
Okay, your blood pressure is 138/88. That is good. if it were to be 140 over 90 or above, that would classify you as having hypertension, which that indeed would be a positive risk factor. Your cholesterol looks good. It's 170, which is below 200. That is good. How old are you?
I am 28.
Okay. Your blood glucose?
My blood glucose, I do not know that.
Okay. Do you smoke?
I do not smoke.
Good. How often do you exercise?
Exercise about 5 days a week for about an hour.
Okay. Good. Good. Okay. Well, this puts you at a low risk. You have one risk factor, which is lower than 2, so you this classifies you at low risk. There will be no need for any medical supervision or health exams, so you are good to exercise. Okay.
Awesome. That's pretty
You guys
good.
sure you guys don't have any questions on what you need to do to further your exercise prescription or anything of that sort?
Actually, I do have a question. What are some ways to get rid of my risk factors?
I'm glad you asked.
I know I have a couple of them.
Yeah, you have a lot more than a couple. Okay, for your smoking, it's a pretty simple answer. Quit if you can.
It's very hard.
I understand that, but you
Very
need to,
stressed.
you need to
Do
find a
it.
way.
I think we could.
In terms of chest pain and type 2 diabetes, you will have to see your family doctor. I don't have the qualifications, but
Okay.
I'd set up an appointment for that. Your blood pressure. The reason this is a positive risk factor is because you don't know it. I mean, you simply just need to get it tested.
Okay.
And your cholesterol is high. I recommend that you just eat foods that are lower in cholesterol. So through dieting and when you're clear to exercise,
Okay.
that will take care of that.
That sounds good.
Do you have any questions, sir?
I do not.
All right. Thank you for coming in, and good luck with your exercise programs.
Thank you.